Hi, my name is Dr. Michael Veslak, and today we're going to talk about those of you that have been diagnosed with idiopathic neuropathy and what to do following that diagnosis. So approximately 30% of patients diagnosed with neuropathy have been diagnosed with idiopathic neuropathy. So idio basically means personalized, specifically to you. Pathy means condition. So idiopathy means personalized to you and there is no known cause. So what are some of the causes of neuropathy? Well, we can have diabetic neuropathy, it can be caused from a spinal condition. We know about chemo-induced neuropathy, medications can cause it, sometimes nutrient deficiencies and or toxicities, autoimmune issues, chronic inflammation, statin drugs, sometimes hereditary issues. There could be environmental toxins, trauma, and then post-surgical. So there's a lot of different causes of neuropathy. The key to the idiopathic neuropathy is to figuring out what actually is the cause. So some of these are easy to figure out, right? You have high blood sugar, you go get your fasting blood sugar or hemoglobin A1C, and it's a little high. You have these nerve issues, you're immediately diagnosed with diabetic neuropathy. They say that the majority of neuropathy is diabetic neuropathy, but what I have clinically found in my practice is that is not necessarily true. It's just the easiest thing to diagnose because the sad but true fact is a lot of people over the age of 65 have type 2 diabetes. The other, easier one to figure out is, the chemoneuropathy. Diagnosed with cancer, get the chemo treatment, then all of a sudden you have this sudden onset of chemo-induced neuropathy. And then spinal issues, right? You get the MRI, it shows severe spinal stenosis, there's no disc space left, compression of the nerve. The conclusion is because your blood sugar is good and you didn't have chemo, that it's due to the spine. So if the nutrients are tested, which they aren't usually, you can be B12 deficient significantly, and that or B1, and that can cause potential neuropathy. And then toxicity of vitamin B6 can cause actually neuropathies. And B6 is actually rarely tested. We can have reactions to medications, Cipro and certain antibiotics, as well as statin drugs can cause an issue. Trauma sometimes can cause neuropathy, just by compression of that nerve and or a syndrome afterwards, like a complex regional pain syndrome. But what about, those hidden things, the environmental toxins that maybe cause it, or perhaps chemical exposure to different chemicals that eventually now lead to an autoimmunity? These are the things that I'm actually finding in my office, but they're never tested. Things like plastic, how they're not only an endocrine disruptor, but they can actually really significantly impact an immune issue. Mold is extremely toxic and create neuropathy type symptoms. Glyphosates, what they spray, what's in like Roundup and things like that are like, it's prevalent all over. So these things are rarely tested. And when I see this high or when I run these tests and I see them high, then I actually know that I can find solutions to help this patient. So, most of you have not been tested for heavy metal toxicity or food sensitivities. Medication reactions, again, is fairly easy to figure out, right? You take the antibiotic, you're taking the statin, and all of a sudden you're having these reactions. Most doctors don't tell you that you need 100 to 200 milligrams of CoQ10 along with the statins. So it can, in some patients, create some neuropathy type symptoms. We can have bacterial issues that have laid dormant for a while and or active, and this can create major inflammation in the body. And so things like strep, staph, H. pylori, Lyme's can affect the nervous system. And then viral issues, Epstein-Barr, this can really impact the immune system and then have a dramatic effect on nerves as well. And again, these tests usually aren't run. I'm seeing the neurologists around the country are actually starting to run a few of these tests. And if you're seeing somebody that has run these, you're seeing somebody really good. So the standard testing is basically you go in, you get the complete blood count, then you go get the complete metabolic panel, which shows you how your liver, kidney, and your red blood cell count, and do you have an infection? Just the basics, right? How your liver's functioning. And this really, most of the time, is fairly normal with patients. You might see some irregularities, perhaps like high blood sugar. But these are the things we need to look closer at. So within the white blood cell count, I like to look at things like eosinophils. So if they're high, that's suggestive of a potential parasite that can create issues. Monocytes within the white blood cell count, if that's high, it can be suggestive of inflammation within the body. A test that I really like that's rarely run is the C-reactive protein. That is the marker for inflammation. I like it in my practice as a functional medicine doctor. Below 1, lab range is below, I believe, 7 or 8, and to me, this is too high. So 1 or 2 is normal. If you're above that, you need to work on getting this down. So then the other test they run is the EMG NCV, just to determine, I guess, the damage of that nerve. I always question, like, okay, so now you did that test, so how does the treatment vary? The same medication is usually prescribed whether you do the test or not. So it's gabapentin, Lyrica. And the skin punch biopsy test, I think, can be a good test, right? It's a test for small nerve fibroneuropathy. But if there are ways to test for small nerve fibroneuropathy without having to run this test, and again, once you get the results, what changed in the treatment? So I believe testing should be done when you actually have a plan and things can change. So, and then, you could have an MRI to rule out, is it spinal stenosis? The reality is most people over the age of 65 have some level of stenosis. Is that really the cause of the neuropathy? And I'm not sure. I see a lot of stenosis in my office. I see a lot of neuropathy in my office. So, and then, sleep apnea can be a cause also, because our neurons, what they need to survive is glucose and oxygen. So if you haven't been tested for sleep apnea, it's probably a good idea to get tested. And sometimes, like, things can show up later in life. You could have had a concussion when you were in your 20s or 30s, and this has now impacted your brain, which can actually affect a part of your brain called the somatomotor and somatosensory strip, which is located kind of like in this part of the brain. It's called the parietal lobe. And what'll happen is it'll affect the way your brain actually communicates with the rest of your body. So some of your neuropathies, like the complex regional pain syndrome, RSD, which is really about the same thing, it's called reflex sympathetic dystrophy. I have found this to be a problem with this somatosensory strip, as well as a part of the brain called the thalamus, which needs to be worked on a little bit also. So you need to ask yourself, has your inflammatory component ever really seriously been addressed? Do you have a healthy gut? Do you bloat up after you eat? Are you constipated? Do you have acid reflux? If the answer to any of those questions are yes, the reality is your gut is not healthy, and you have to fix the gut first. The gut and the brain have a connection, which I'll talk about in a little bit here. Have you been checked for food sensitivities? Do you have reactions when you eat these food that create this inflammatory reaction that's eventually, again, going to affect not only the inflammation within your body, but affect the brain and how it communicates with the rest of your body? Sometimes omega-3 fatty acids, we're deficient in these. Our diet is heavily reliant on the omega-6s and not the omega-3s. This is more the standard American diet, like the heavy meat eaters, the carnivores. And this, if we don't have enough omega-3s, this can create inflammation in the body also. Then I talked about the C-reactive protein. This is the blood test that should be run to look at the overall inflammation within your body. So treatment, in my opinion, should always be geared towards suppressing symptoms. So, and then trying to figure out the cause and fix the cause. Now, medication's job, when you go to the doctor and you get prescribed the standard neuropathy treatment, the gabapentin, Neurontin, Lyrica, then basically the goal there is just to suppress the symptoms. Now, what happens is, feel a little better, a couple months later, you go back, symptoms are getting a little worse, they up the dose, keep upping the dose. And the reason is because the cause was never found. It was never found. You were diagnosed with neuropathy, but nobody really told you how to regulate that blood sugar. You might be on metformin, but you still feel like it's okay to eat the things you should eat and not work on getting that blood sugar below 100 fasting, your A1C below 5.6. So you have to find the cause. And the medication might provide you some relief, but it surely isn't going to stop the progression of the disease. Neuropathy is a progressive degenerative condition. And then the side effects that come with the medication, right? Some of you are well aware of these: the brain fog, the weight gain, the irritability, loss of sleep. And I know a lot of patients that I've consulted with online or in my office have really worked hard to get off these medications, are looking for more of a natural approach because of these horrible side effects. Now, for those of you that are not having side effects and you're getting great relief with the medication, I think that's great. I mean, and if the disease is not progressing, then fine, continue to take the medication. If you feel like that's not your answer, then start to search for a natural solution. So, in my opinion, idiopathic neuropathy is probably right up there with the hardest neuropathy to fix. I mean, it's really hard to change genetic neuropathy. You just try to manage it. But the idiopathic, you really have to have a whole body approach. And so what we do in our office and the whole body approach is what they call functional medicine. The goal is to find the root cause. Now, there's a guy at UCLA that just recently, his name is Dr. Bresden, wrote a book on the cure for Alzheimer's. And the first chapter in his book, he writes, "I want to thank my wife for turning me on to functional medicine, because now I realize you need a whole body approach to fix these chronic degenerative problems. You can't do it by symptom medication." I mean, you hear the commercials, you take the medication, there's going to be all these other potential side effects. It can't be that great for you. So what we try to do is, in our office, we try to run the proper labs, find the cause, work on the whole body, evaluate the whole body. There's so many different variables that can be contributing to the neuropathy, especially the idiopathic neuropathy. And then the peripheral neuropathy is really a symptom of a much deeper underlying problem. So our body is like it's like a beautiful, orchestra playing that symphony. Every single part needs to work together in a harmonious way, and that's how we really achieve optimum and great health. So for those of you that the medication didn't change it, didn't cure it, what you really need to look at is the diet and lifestyle. The problem is it's hard work, right? It's hard to change a diet that we've been used to for 60 years. It's hard to say, hey, I'm going to start to exercise now, when you're so used to now sitting on the couch and not doing anything because your feet hurt. I get it. It's super hard, but you have to start and take one step at a time, set goals for yourself, make them realistic, and then work with a practitioner like myself that can actually guide you through the different stages to figure this out. So I wrote a book. I mean, a lot of you have read it, and I really appreciate the support I've gotten. It's really been the top seller on Amazon on the subject of neuropathy since I wrote it a couple of years ago. So I really appreciate all that. So in that book, I wrote it primarily for these groups that I help on Facebook, because I realized that so many of the people that were suffering from this horrible problem, and especially idiopathic neuropathy, really didn't have any answers. So I took on the task of trying to explain it, but it's super difficult because there's so many different causes of neuropathy. So I couldn't really be exactly specific about the treatments. And I would love to take each individual and talk about their problem and how I would treat it, because it's a little bit different for everyone. So in the book, the treatment is a little bit generalized, but the causes, I kind of go in depth of all the potential causes. So it might resonate with you, oh man, I'm going to get that tested and maybe it'll help you. So the book, it's called Understanding, Managing, and Improving Your Peripheral Neuropathy. You can find it on Amazon, and it's in the Kindle or paperback. So the tough part with treating any chronic problem is each individual is slightly different, and the formula to improve is slightly different. We're just different people. We have different causes. Just because we're labeled neuropathy, the treatment is not going to necessarily work the same for everyone. But what remains unchanged is the foundational principles. Find the cause, fix the problem, find the solution, people will improve. So for me, where I really start most of the time is the gut. The gut is where a lot of our immune system resides. I would say 70 to 80%, primarily because when we ingest food and these different particles, we want to make sure our body can handle the different bacteria, parasites, virus that were being ingested at that time with the food. So the first line of defense is really within the gut. So the gut and the brain communicate nonstop in a bidirectional way. So gut, brain, brain, gut. Gut's not healthy, it's going to affect the brain. Brain's not healthy, it's going to affect the gut, primarily through the vagus nerve, the vagal tone. And so it's a bidirectional communication. So what I look at first, again, gut issues, bloating, constipation, even diarrhea, back and forth constipation, diarrhea, and then acid reflux. Those are some big triggers. And obviously pain in the gut. Now, the interesting thing about gut problems is most of the symptoms in the gut are silent. You have no idea you have these issues until I run a certain test, and then we can actually see how much inflammation was in that gut. So if you're not getting proper input, so if your gut isn't healthy, the output of the brain is going to be affected. That affects all parts of the body, right? The peripheral nervous system comes from the central nervous system, which is brain, spinal cord. Of course, we all know this, right? We have to eat healthy. So whole foods, no processed food. You want to avoid the inflammatory foods. So my 5 are no gluten, no dairy, no soy, no sugar, no alcohol. These are triggers. Now, it doesn't mean every single patient has to get off gluten for the rest of their life. What you need to do is experiment, get off all 5 at one time, reintroduce one at a time to see if you react to it. So if you don't react to gluten, you're not gluten sensitive, that's fine. I actually test for it in my office. I actually see, are you sensitive? And then the test actually shows me, does that gluten sensitivity react to 3 places: your nervous system, your gut, or your skin? So if you're getting skin rashes, if your gut is not healthy, then these are reactions to food sensitivities. We're having a problem digesting certain proteins. So, but for others, it's different things. It could be nightshades. So I see tomatoes as a trigger, peppers. It could be lectins. So what we need to do, if it's a complicated case, we actually need to test to determine what the vulnerabilities and susceptibilities are. Then we want to try to exercise, right? The goal is 20 to 30 minutes per day, and it's hard if you haven't exercised for a while, but it helps with something called the BDNF, brain-derived neurotrophic factor. And what this does, this actually helps neurons actually reconnect, grow back together. This reestablishes proper communication. So it is hard to fix a neuropathy without reconnecting the neurons. So we can't really change the number of neurons we have, but we can change how they communicate. And then, of course, we all know we should try to strive for the 7 to 8 hours sleep. And sometimes as we get older, that gets a little bit more difficult, primarily because our circadian rhythm gets affected by probably inflammation of the body and the brain, right? Cortisol levels can go up, could be the gut sensitivities like I talked about. So in my book, I dedicate an entire section on sleep. And a couple tips are basically start turning the device off an hour before you fall asleep. Start to make the light in the house a little, darker, a little more dim, And then make sure when you do sleep that the bedroom is dark, and you keep the devices, the cell phone, away from your bed. And then, of course, we need to find time for ourselves. So we need to do things for ourselves. That's really important. So meditate. You can be creative with artistry or music, or some people like to journal. Sometimes finding that deep spirituality is really good for that person. So it's super important to find time for yourself and relax and just unwind. So some of the testing that I do in my office to figure out the cause, and I don't run these on everybody. We do a comprehensive history. We try to narrow down what tests or tests are going to be the most value, because I don't like to spend a lot of money for a patient if just to run a test. I am looking for things that I think might contribute to the ultimate solution and get this patient better. So some of the tests I run are the organic acids test, which I used to say it's my favorite test, but I've come to really like the Cyrex test a little bit better because they're a little bit more specific. But the organic acids test gives us so much information about our body that I really do like that test. The gut microbiome, to see the health of the gut. So I like to do that. And then the Cyrex test, I mentioned a few of them here. So the Cyrex 3, if I feel like you're gluten sensitive or have celiac, we run this test and see if you are reacting to the nervous system. If so, it's a big deal. You have to stop gluten or you will never, ever get better. Cyrex 5 is a multiple autoimmune panel, and it can determine, do you have autoimmunity to your nervous system? So certain parts of the nervous system, if that comes out positive, then you know specifically what part of the nerve it's affecting. And then you have to go a little further to look at array 11 and 12, the chemical and pathogen autoimmunity panels, to determine what is the trigger. Is it mold? Is it limes? Is it strep? Is it plastic? Is it benzene from the gasoline? Is it the glue in your carpet? Is it formaldehyde? I mean, it tells you specifically what you are developing antibodies to, and then you see what your immune system is reacting to. That's how you find the cause. That's how you solve the solution of idiopathic neuropathy. So, and then sometimes, you need to do other tests. You need to look at heavy metals and mold and what they call glyophosphates that's in Roundup, and unfortunately in probably all of our water supply. So these are serious toxic issues that are like all over the place, that our body is actually designed to handle it, but for various reasons, through genetics and other reasons, our body gets to a point where it doesn't handle them as efficiently as we get older. So there is supplementation that you can take to make this process more efficient again. And then we need to look at like hormones and fatty acid. So as I said, finding the cause of idiopathic neuropathy is hard. It's hard work, but if you're motivated to actually improve, so you don't have to think about, do I really want to go there? Because, I can't really feel my feet, or they're in so much pain, I don't really want to walk or stand. So if you really want to change your life and spend more quality time with your family and truthfully yourself, then find the cause and fix it. And then we like to remove the cause, replace it with good nutrition, and start to repair it the way we need to through different exercises that are specific to that neuropathy, good nutrition, good diet, good lifestyle that we talked about. So, I'm asked this all the time, can it be reversed? Well, they say in the literature it can't, but I've clinically seen it that it can. Now, is everyone going to be reversed? No. I've seen some chemoneuropathy reversed. I've seen some idiopathic neuropathy, when you figure out the cause, reversed. But for the most part, what we're looking for is to make significant improvement, that the quality of life gets better and the progressive degenerative nature of the disease doesn't progress. So, and to try to eventually have you have a conversation with your doctor to get off the medication because you're feeling better and you don't want the side effects of the medication. So I tell patients, don't settle for the diagnosis. Diagnosis is a label. If you've heard that, oh, you have neuropathy, there's nothing can be done, be proactive, do something about it. Thank you so much for listening today. If any of you want to email me, my email is dr. my last name, Veselak, @gmail.com. And then you can visit my website, drmichaelveselak.com. I have some other videos on neuropathy, a few on functional medicine, a couple on genetics, and I'm going to keep adding content and blogs. I have probably 70 different blogs on that website that might interest you on just health. And then if you haven't, and if you're interested, go to Amazon, purchase my book. I believe the Kindle is $9. The paperback is probably close to $15. It is Understanding, Managing, and Improving Your Neuropathy. If you decide that you want to pursue this further, I do online consults with people actually all over the world on the subject, and it's easy enough to do, easy enough to get you the different test kits to have it run. And so if you're interested in that, you can contact me by my email. Thank you again, and I look forward to hearing from some of you.